First off, congratulations on being selected as a clinic manager. That's exciting. And welcome to the Healing Clinic Steering Committee. During this video, I'm going to orient you to the duties of the clinic manager role. The hope is that this video will leave you feeling extremely prepared to run clinic effectively and efficiently on your own from day one. The Healing Clinic at Family Medical Counseling Service is a wonderful opportunity for our students to learn medicine, bread and butter medicine. But it's more than just an educational experience. It also represents an opportunity for GW students to better integrate themselves into the Washington, D.C. community. And that's really important. To get started, let's review some geography. This is a map of Washington, D.C. A really bad map of Washington, D.C. And this is GW, which is located in Foggy Bottom in Ward 2. And this is our partner clinic, Family and Medical Counseling Service, which is in Anacostia inside of Ward 8. Geez, that's a really bad map. That's okay though. So GW is located in Foggy Bottom in Ward 2, which has historically been DC's most affluent ward. FMCS is in Anacostia, which is in DC's poorest ward, Ward 8. At the time that this video was being created in April of 2012, Anacostia had the highest HIV prevalence in Washington, D.C., and the highest unemployment rate in the entire country at 25.2%. So you can see that there's a pretty striking difference between where we go to school at GW and where we practice medicine at the Healing Clinic. Needless to say, healthcare services and resources are not distributed equitably throughout the district. The greatest gaps in access are in Wards 7 and 8, areas of the city that also suffer from the highest prevalence of chronic diseases. These diseases, including HIV/AIDS and cardiovascular conditions, could be avoided or treated with better access to primary care. However, lack of access does not paint the entire picture. The social determinants of health also play a significant role. That phrase, the social determinants of health, is this idea that social, economic, and political conditions, such as the family or even the neighborhood that you're born into, influence individual and group differences in health status. So how this manifests is that, for example, one of our patients at clinic may be too concerned with putting food on the table as a single mother to worry about her own health. Or, as another example, a man might have grown up within a culture that doesn't necessarily value healthy habits, and so he has a hard time wrapping his head around why visiting the doctor's office and taking medication is important. And that's precisely why it's important that you, as clinic manager, help make our patients experience at clinic enjoyable and productive so that they want to come back. Now, these examples I've provided are obviously oversimplified, but you get the point. And that brings me to your two overarching responsibilities as clinic manager. Overarching responsibility number uno, sensitivity. This refers to what we were just talking about, the social determinants of health. Many of our patients are HIV positive, or O42, as we're supposed to refer to them at clinic. We also have a number of transgender patients, and often we have patients who are both transgender and O42. So as you can imagine, we have an extremely sensitive patient population. Your job is to make sure our patients feel comfortable among a group of students who look very different from themselves. We'll come back to how you can practically implement this later in the video. Your second overarching responsibility is efficiency. Part of your role entails making sure everything is running on time. It's important that you remember that most of our patients would prefer to leave clinic before it gets dark outside, as Anacostia isn't a super safe neighborhood like Foggy Bottom. So you have to always keep time in mind, but at the same time, not compromise our patient's quality of care. How do you do that? Well, much of it has to do with troubleshooting, and we'll get back to that. At this point, I want to illustrate what a typical evening is like at clinic. So imagine this scenario, if you will. From 4:30 p.m. to 4:40 p.m. You enter clinic at 4:30 p.m. with a fresh batch of volunteers. You escort the volunteers to the meeting room where they undergo orientation. And then you walk across the hall to the main clinic. You log into a clinic computer to find that there are 6 patients scheduled for tonight. You write down their names, their chief complaints, and as you're doing this, you peer into the waiting room to find that 2 of your patients have actually already arrived. They're early, but you don't want to make them wait. So you go set up the laptops in the exam rooms, log into eClinicalWorks, and then head back over to the meeting room to steal away 2 exam room teams to begin seeing these 2 patients. In this 10-minute period, you've accomplished 2 things. 1, you wrote down the patient names and their chief complaints. And 2, you sent 2 of your exam room teams to begin seeing 2 of the early patients so that these patients wouldn't have to wait. Great job. Now fast forward 20 minutes. It's 5 p.m. Your volunteers have completed orientation and are now ready to move from the meeting room to the clinic. You don't want to disrupt the daytime staff or patients, so you very quietly show each volunteer where he or she will be stationed. Then you take the attending physician to her room and log her into ECW. After you've shown everyone where they need to be and helped troubleshoot any ECW issues, the hallways are nice and empty. That's right, empty. This is perfect because the hallway is your station and your sanctuary, no one else's. The hallway is where you will be stationed the rest of the evening because it's accessible to any volunteer who might require your assistance. Don't allow your hallway to fill with volunteers because this makes your patients feel vulnerable, and that's not at all what we want. So empty hallways at all times, please. During this period of time, you've accomplished 3 things. You logged everyone into ECW, you cleared the hallways, and then you stationed yourself in the hallway because it's the best way you can fulfill your dual responsibilities of promoting efficiency and sensitivity. And it's now 5:15. 5:15 to 6:30 p.m. You begin knocking on exam room doors to signal that only 5 minutes are remaining for the patient encounter. The first exam room team exits their room and they're making their way to the attending physician room to present. On the way, you ask the 4th-year medical student if you can help with inputting the assessments, in other words, the medical problems, the labs, and or the referrals into ECW for him. You then log into a computer to quickly but carefully input the information he's given you into the corresponding patient's chart. Then you return to your home base in the hallway. You've accomplished 2 things during this 45-minute period. You've warned all of the teams they need to begin wrapping up their history and physical when the 5-minute mark approaches. And number 2, you've taken some of the burden of using ECW off the 4th-year medical students' hands by offering to input their patients' assessments, labs, and referrals for him. That's huge. So great job. 6:30 p.m. to 7 p.m. Until this point, you had done everything perfectly. It's like you were the Flash. You were everywhere at all times, assisting in every possible way to make sure things were flowing smoothly. You did great. But now, there are 4 patients in 4 exam rooms, 1 patient in the waiting room, and the attending has only seen 1 patient so far. So you're running behind, and things are beginning to get a little bit crazy. Times like these, it's really easy to forget about the tools you have at your disposal. So I want to go over them now with the hope that you'll remember these things when you're in dire straits at clinic. Number 1, be accessible. The hallway is your sanctuary. Don't leave it unless you're helping someone to do something. And don't let other people congregate in it because you want our patients to feel empowered, not vulnerable or violated. Number 2, don't wait for questions. Anticipate problems. If you see a student struggling with the EMR, ask him what you can do to help rather than waiting for him to ask you. Number 3, hospitality goes a long way. Pretend you're a manager at a restaurant. If you notice a patient is unhappy because she's been waiting too long, apologize for the delay and then notify the team that their patient is getting antsy. Number 4, and this one's really important, master eClinicalWorks. Learn eClinicalWorks like it's the back of your hand so that you can quickly and accurately put in assessments, labs, and referrals for your exam room teams. Number 5, promote excellence. Don't slack off and don't let others slack off. Work your hardest to ensure that, as a clinic, you're providing the highest possible quality of care to your patients. As I'm sure you can tell by now, the FMCS specialist role carries a lot of responsibility and is incredibly rewarding. After all, at the end of the day, you have the most influence over the quality of care that we provide at the Healing Clinic. To help keep you on track and serve as a reminder of your responsibilities, please remember to use your checklist each time you're at clinic. Thanks for your time and have an awesome year.